A brain hematoma is a deadly pool of blood growing in the brain.
When a person develops a brain bleed, the pressure inside of the skull can get to a dangerous level, and this is called intracranial hypertension. And all patients will develop the same three symptoms: hypertension, bradycardia, and irregular respirations. This is called Cushing's triad. Cerebral perfusion pressure is the pressure that is driving blood to the brain, and it equals mean arterial pressure minus intracranial pressure. So if you have an elevated intracranial pressure, you have a decreased cerebral perfusion pressure. And this means that the brain is not getting adequate blood flow. And so as a response, the body will trigger the sympathetic nervous system to increase the systemic blood pressure. This is the first sign of Cushing's triad. This hypertension will then be recognized by brainstem centers and reflexively trigger a parasympathetic response through the vagal nerve. And the parasympathetic response will then trigger bradycardia, and that is number 2 in Cushing's triad. And increased intracranial pressure can lead to a herniation, which can then potentially compress the brainstem. And because of this, the respiratory centers within the brainstem might malfunction. And that is what leads to irregular respirations in Cushing's triad. Elevated intracranial pressure can also lead to things like a blown pupil, where you have compression of the ipsilateral oculomotor nerve. And this would be considered a surgical emergency, and a patient would need to go to the operating room by a neurosurgeon for what's called a decompressive craniectomy.